When we have determined that the patient is critically ill and needs to be intubated, basically put on a ventilator, we need to gather all the equipment that we need and all the staff in order to get ready for the procedure. And this typically is an emergency situation, but it can also be controlled, let's say, in the operating room. But the equipment will always be the same. So number one, we need our intubation equipment, so our ET tube. We also need a BVM and an oxygen supply. We need suction equipment handy just in case we need it. We need to make sure we have a good IV access in order to give the patient medication before we intubate them. We need to make sure we have our respiratory therapist and the ventilator there so we can hook them up to the machine once the intubation has taken place. Remove any dentures or loose teeth from the patient's mouth before intubation so that they don't break and cause a potential airway obstruction. And then we need to administer the medication, sedatives as well as paralytics, in order to make the patient more relaxed and sedate them prior to the procedure. And before the ET tube is placed, we want to make sure we pre-oxygenate the patient for at least 3 to 5 minutes at 100% of high flow O2 to make sure that we give ourselves enough time for the intubation to take place.